Good morning. Can everybody hear me all right? Great. Well, my name is Judith Finlay, and I'm an employee of the binding site, and I'm going to talk to you today about understanding serum-free light chain assays. So how many people in the audience know or have heard about the serum-free light chain assay? Okay, there's a good number of people that have, but there's a good number of people who haven't, so I'm glad you're here. I'm going to go over it in this presentation, but we have a table right outside this door, and I'm happy to answer any questions. I'll be around all day until 4:30. So to start off, one of the other things that's very important is I've noticed it really helps people to understand their myeloma if they start understanding the free light chain assays and how they're used. So this should be very helpful in helping you understand a lot of the things that are going on. So first I'll give an outline of my talk. I'll give you some background, and then I'll talk about tests that are used to assess multiple myeloma, some advantages of the serum-free light chain assays. I'll go through this several times so you really understand that well. Then I'll talk about some practical considerations, and then there's new guidelines that came out last year. I'll talk about those, and then I'll summarize. So multiple myeloma, as you know probably from the earlier speakers, is a cancer of the plasma cells. And the cancerous plasma cells accumulate in the bone marrow and causes symptoms of the disease. And some of these symptoms can be increased infections, kidney damage, anemia, or bone damage. And testing can be used to monitor the disease and guide the therapy. So the plasma cells are found in the bone marrow, and the bone marrow is a soft blood-forming tissue that fills the cavities of your bones. And the cells are produced in there, red blood cells, white blood cells, and platelets, and other cells. And one of the types of white blood cells are the plasma cells. And this is a photomicrograph showing the plasma cells that are in the bone marrow. Now the plasma cells produce antibodies and light chains. So here's the antibodies, and the free light chains are also produced by these cells. And there's two types, kappa and lambda. And there's actually two different assays we make, one for the kappa chain and one for the lambda chain. So antibodies are made up of heavy chains and light chains, as you can see. And this slide shows the antibodies, or they're also called immunoglobulins. This is the structure, the heavy chain and the light chain. And an important thing to remember is this whole part here is called the constant region. It's virtually the same in all the antibodies. But then there's the antigen binding sites here, which are the workhorse of the antibody that help it do its job. Its job is to bind different molecules or viruses, for example, and eliminate them from the body. So this is variable. And each patient's monoclonal protein is different. So that could be why there's differences in each patient as they go through the course of the disease. This shows the difference in the bone marrow between normal versus myeloma. Normally in the bone marrow you have a variety of different plasma cells producing a variety of different antibodies and a small amount of free light chains. But then during the cancer process, one of these cells will become cancerous and overgrow large parts of the total bone marrow. And that'll produce too many of the antibodies, too many of the light chains, and these can result in the symptoms of the disease. There are several tests that are used in multiple myeloma. One is called serum protein electrophoresis. It has a variety of different acronyms that are used for it. I've listed those here, SPE, PEL, SPEP, or PE. The important thing is it measures the M protein concentration, the M protein that Dr. Kyle had mentioned, in grams per liter. Then there's another assay called Immuno-Fixation electrophoresis, and that is almost always abbreviated IFE. The reason I talk about these abbreviations is they're often in your laboratory reports, and many times the full name is not written there. So the IFE identifies what type of M protein you have, and this can be important to physicians following your care. And then the important thing about this test is it's qualitative. It's either plus or minus. Either you have it or you don't, which is different from this that tells you how much you have. Then finally, we have serum-free light chains, which is the test I'm mostly focusing on. We abbreviate this SFLC. We also call it free light. That's the brand name for the two assays. and it measures the light chain concentrations usually expressed in milligrams per liter. So here are some of the advantages of the serum-free light chain assays. It's a serum test that's specific for free light chains. It's very sensitive for the detections of the free light chains. It can help many times to determine early detection of response to treatment, and many times it can show earlier detection of relapse. And I'll show you some examples of that. So the tests measure antibodies and light chains. So the antibodies are generally measured by the SPEP and the IFE, and then the free light chains are measured by the serum-free light chain test. This shows serum or urine protein electrophoresis, what it looks like. And I'm not going to go through this in detail, but this is what the normal pattern looks like. In the focus on the gamma region, it's just a small, fairly wide band normally. But if you have myeloma, it's a large spike or monoclonal spike. So the advantage that shows light chains are very sensitive assays. In here, they're actually reading down into the milligrams per liter. The SPEP reads in grams per liter, so it's a lot more sensitive analytically. And these are the normal ranges that have been determined for the light chains. The kappa is 3.3 to 19.4 milligrams per liter. Then the lambda assay, if it's normal, it should be between 5.7 and 26.3 milligrams per liter. And the ratio, kappa over lambda, should be 0.26 to 1.65. And these ranges should generally be found on your laboratory reports.